The Global Equality Caucus is an international network of parliamentarians and elected officials who advocate for LGBT+ equality. Included in our mission is a drive to ensure that marginalised groups have equitable healthcare access and can access services like HIV care without facing prejudice. Last year, we produced the Europe edition of our HIV Prevention Handbook, which highlights several key prevention strategies in the HIV response and outlines what legislators can be doing to ensure the legal environment is working for underserved communities. We launched the handbook at EuroPride 2022, where legislators agreed to take forward recommendations to improve HIV prevention in Europe. Since then, new data has been published, so let's take a look at some of this data and best practice to enhance your advocacy. The latest ECDC and World Health Organization data covers the first full year of the COVID-19 pandemic, so we need to be conscious of underdiagnosis and underreporting. Despite this, over 100,000 new infections were reported in 46 out of 53 countries in the World Health Organization's European region, including over 16,000 new infections in the European Union. And, amongst EU countries, men who have sex with men account for 55% of new diagnoses where the route of transmission is known. The data also shows an increase in cases amongst MSM born outside of the country of diagnosis, and overall, migrant populations accounted for 42% of new diagnoses in the EU. This suggests there is still work to do to ensure that prevention strategies are reaching key populations impacted by the epidemic. How do we make this work more effective? There are multiple strategies identified in the handbook, but let's take PrEP as an example. It's a drug that's up to 99% effective in preventing people from contracting HIV, if taken as instructed. But it's only subsidised through public healthcare systems in 23 European countries, and 5 EU countries are yet to formally implement PrEP provision at all. Legal barriers are one of the main reported obstacles to a formal rollout of PrEP, and that's where legislators come in. You can review existing health regulations, vote to approve routine commissioning, approve budgets to subsidise PrEP through health services, and you can pressure governments to widen its availability. Diversifying availability is crucial, especially if we're to see prevention tools reaching key populations like gay men and migrants. In most countries, PrEP is only available in clinical settings, but some people may not feel comfortable accessing these services due to stigma, or, in the case of undocumented migrants, may not be registered with a health provider. Empowering community providers to run services outside of conventional healthcare settings is one answer. This includes licensing NGOs and HIV charities to offer prevention tools like PrEP and HIV testing, as well as making these tools available in pharmacies rather than exclusively sexual health clinics. Free, anonymous, community-led services can more directly reach underserved communities in a stigma-free environment. And this innovative community intervention model has been endorsed by UNAIDS, the ECDC, and the World Health Organization. It's something several countries are moving towards, but we need legislators' help to make it happen. Here's Lisa Power to explain what work has been done in Wales and where this work needs to go next.
In Wales, by working together in coalition between government, civil society and the health sector, we've created more HIV prevention work in the last 3 years than the previous 10. We've got a national testing week, GP recommended home testing, anti-stigma and awareness campaigns, and now we have a national HIV action plan with community voices intrinsically engaged throughout it. But the community can't do any of this stuff on our own. We need to work with politicians to shift outdated laws and regulations, like the ones that keep PrEP only available in clinics. We need to be able to work smarter and more cost effectively together. Politicians and the people working together, we can move mountains, including in HIV.
So what can you do as a legislator to ensure that HIV prevention strategies are reaching populations impacted by the epidemic? Well, we've touched on some of the options already. The key is diversifying availability. You can ensure the HIV response is funded adequately in healthcare budgets. You can reform outdated laws that restrict PrEP and testing to clinics. You can approve licenses for NGOs and community organisations to provide these services. You should continue to be guided by the latest data to ensure interventions are reaching the right communities. And remember to tell your colleagues and mobilise parliamentary support for innovative new approaches to provision. And, of course, continue to challenge discrimination in all its forms so we can eliminate the stigma that underlines the HIV epidemic. Thank you.